Hello there, Charlie here, back in the bunker proper with another broadcast from the bunker. Today is Tuesday, April 21, 2020. Some of you are probably asking why I'm doing this, and even if you weren't asking, I'm going to tell you. I'm practicing for prime time, something of a late in life aspiration. I'm expecting a call to audition at least, anytime now. So in the meantime, coronavirus is the subject of one more broadcast as I try to sort out what I think. Things are happening and the situation is complicated. There's much to sort out. For starters, there are positive developments. The curve is flattening worldwide. The Johns Hopkins Resource Center chart of daily newly confirmed cases shows that something of a leveling off. This chart is from Friday, April 17th. The U.S. is easy to pick out as the top green line. It peaked at just over 33,000 new cases as of April 16th. And where it dropped to 29,000. This is a 5-day moving average. And to put this in perspective, we need to remember that the first case of COVID-19 in the U.S. was reported 84 days ago on 1/22/2020. Since then, the country has reported 667,801 cases and about 32,000 deaths, I think. More good news is that there are at least 5 candidate vaccines undergoing preliminary testing in humans. One of these was developed by a well-respected lab in Oxford, UK. The Oxford scientists are confident enough that they plan to begin manufacturing 1 million doses before trials are complete in order to have the vaccine available in September this year. This is a big bet. They will have to throw away tens of millions of dollars if the vaccine fails clinical trials. So I expect that they have a high degree of confidence. And another good news item is that I found toilet paper on the supermarket shelves last week. That has to be a good sign that things are improving. But on a truly sobering note, unemployment continues to soar. Initial unemployment claims showed that 22 million workers in the U.S. are out of work. The chart here was extracted from an article in the New York Times. The U.S. in its history has never seen such a rapid spike in unemployment. And the same article states on Wednesday that the Commerce Department reported the steepest monthly drop in retail sales since record keeping began about 30 years ago. And the Federal Reserve said industrial production recorded its biggest decline since 1946. So it's certainly reasonable that since Easter weekend, major discussion has revolved around returning to normal. And I'm not sure how precisely to define that, but normal includes relaxing social distancing, allowing people to return to work, reopening schools and retail establishments. But the economics of returning to normal will be determined by meeting the health challenge posed by the coronavirus. Kenneth Rogoff, a well-respected economist and co-author of This Time is Different, recently stated that it is impossible to predict an endgame without knowing how the health challenge will be met. Rogoff goes on to say, Americans will find it exceedingly difficult to return to economic normalcy until a vaccine is widely available. Social distancing has been the key and perhaps the only weapon to fight the virus thus far. The decline in growth of new cases provides evidence that it's actually working. So don't forget that social distancing was designed to protect against a potential future condition, such as what overwhelmed Italy. The fundamental measure of success is not what happens, it is what does not happen. And we have to keep that in mind in the face of a clear economic pain that's visible to all of us. And we have to do everything possible to mitigate that pain for the people that are most affected. So to focus on Rogoff's assessment, we must know how the health challenge will be met before we can know how to tackle the economic issues. And the problem is that we don't know enough about this virus, officially designated SARS-CoV-2. There's a huge amount of uncertainty, and we don't know the infection rate or the death rate in this country because testing has been so limited. We don't know how infectious the virus really is. We don't even know how many people have actually been infected. Estimates that I've seen put it at 3% to 10% of the population. We won't know any of this until we complete extensive testing. Keep in mind too that consumers drive about 70% of the U.S. economy. All this uncertainty is not lost on consumers, that is, us. And ask yourself, if we go back to normal, what will I really do? Will I go to the movies? Will I go out to eat in a restaurant? Will I fly on an airplane or go to a concert? A Gallup poll released on April 14th found that 71% of respondents will wait to see what happens with the coronavirus before restarting their normal activity. If we think we can just flip a switch and go back to normal, we are surely misthinking. The virus hasn't disappeared, so what happens really does depend upon individual and collective human behavior. We could well be in for another wave come this summer. I'm preparing myself for some degree of social distancing for the next year. An article in Science, written by professors at Harvard's T.H. Chan School of Public Health, sums it up. We projected that recurrent wintertime outbreaks of SARS-CoV-2 will probably occur after the initial most severe pandemic wave. Absent other interventions, the key metric for the success of social distancing is whether critical care capacities are exceeded. To avoid this, prolonged or intermittent social distancing may be necessary into 2022. So now what should we do? There's been a lot of talk about herd immunity. This comes from either having a large percentage of the population become infected and develop natural immunity or widespread vaccination. Estimates that I've seen calculate that anywhere from 50% to 66% of the population needs immunity in order to achieve herd immunity for the coronavirus. That's why the news of the vaccines are beginning human trials is such good news. The bad news is that under ideal circumstances, it will be September before a vaccine even becomes available. And I think the number of doses that we will need, hundreds of millions on a global scale. So that applies a huge ramp up in the manufacturing capacity. I could actually spend more time talking about this, but the main point is that we have months, maybe years, to go before we can achieve widespread vaccine availability. Obviously, we need a plan to get back to some kind of normal over a shorter time. European countries are starting. Germany is beginning to reopen businesses. And one of the first countries to ease social distancing is Austria. I watched Fareed Zakaria discuss Austria's plan with the Austrian Chancellor on his show this Sunday. The Austrians have a plan that's incremental, slow, and deliberate. It is based on 2-week intervals in order to determine if there is a ramp up in cases. And we might do well by following their example. The U.S. governors are getting together to develop plans for their states and regions. California, Washington, and Oregon are working together. New York, New Jersey, Connecticut, Massachusetts, Delaware, and Rhode Island form another regional planning group. There's also a Midwestern planning coalition comprised of Michigan, Wisconsin, Illinois, Ohio, Indiana, and Kentucky. These regional groups represent more than half of the country's GDP, and these coalitions can best adjust to the requirements of their geographies. I think they offer the best hope for safely restarting our economic engines. As a closing note, I have to add one thing that is clear to me. As a country, we need to invest more in public health. Our healthcare system is designed as a for-profit system, and there is no profit in preparing for a pandemic that may or may not happen. So we have not been ready. We should add this into our planning process.